What's up, guys? We're here for, what week are we on?
I think this is number 8 of Doc Talks. That's what we're going to go with.
Week 8 of Doc Talks. Can't believe it's been 2 months we've been doing this, so we're pretty stoked
We grow up so fast.
to keep on giving you guys information week to week. This week's topic, as you can see from some of our Instagram posts, is headaches and getting a little bit more knowledge on maybe your headache and what to do for it.
Yes. So if you have neck tension, you got headaches on the front of your head, the sides, piercing stuff through the back of your eyes, this one is for you.
This one could definitely help some of those. So first off, we're going to go through a couple of the types of headaches. Now, some of the terminology might not mean too much to you, but the symptoms, hopefully if you connect with some of those, it'll grab your attention. You'll be able to listen and find some stuff, some gems throughout this talk that could help you. So first off, a tension type headache. This usually has a little bit more to do with like the environment that we're putting ourselves in. So if every day at 2 o'clock, you have a stressful event coming up, you have to talk to a boss, you have to talk to a supervisor, and that's kind of coming up, and you start to get that headache that comes on. Tension type headache might be the type of headache that you have. There's also migraine headaches. Migraines are something where you can or you can't have like a visual, what's called an aura. So you see like these little rings or sparkly things when you're looking around. And it's usually brought on by a trigger, and they're usually very debilitating, something that'll knock you out for a decent amount of time. My wife has actually struggled with some of those in the past, but she's figured out her triggers and she's been able to conquer some of that stuff. So tension type headache, migraine, you can speak to the other two if you want.
Yeah, so there's also headaches that can originate from issues within your neck. So many of the muscles and other tissues in your head also have attachments at your neck and your jaw, and anytime you have an issue there, whether it's a restriction or motion, or you have some issues with your bite, that can alter the resting tension of some of the tissues there, increase pressure, lead to issues up in your head. And then cluster, that's a doozy.
That's a tough one.
There's a lot going on with cluster headaches, and that can be a wide variety of symptoms.
Yeah, so cluster headaches are those ones that they're kind of short, but they are some of the research says they are some of the most painful types of pain that the human body can actually experience. So if it's something that knocks you off your feet, people will describe like it feels like one side of their whole face is like just shutting down and just like squeezing down. That's one of the signs of having a cluster type headache. And again, one of the ones that doesn't really have a lot of, hey, that's exactly what causes it. Cluster, what's called a cervicogenic headache, or something that could be related to the neck, migraine type headaches, and tension type headaches. All those have different types of symptoms. Some of them can overlap sometimes, but those are the ones that we'll be kind of speaking to and having a little bit more of a maybe trigger management. That leads us into our next, we're gonna go to bad stuff first. So if you have more than just these types of symptoms for your headache, these are the big red flags that we're gonna look for.
Yeah, so the things we talked about before, we can definitely show you some amazing things to help with that. But if you have this stuff, do not call us. Go see your doctor, or even go to the ER. If you've fallen, hit your head, you got a major headache, you definitely want to get that checked out by a professional. If you have not had a history of headaches and all of a sudden you have a splitting headache, worst headache possible, there's nothing worse than that. That's also definitely something that you would like to get checked out. Other things that could be a possibility if you have any signs and symptoms of fever or anything like that. I'm trying to think of some of the other big things.
So if you have correlating pain that kind of maybe goes down the arm, if you have tingling, you have anything that's kind of going down either arm. We're not talking about either rights or lefts, because we can have big scary things that happen on either the right side or left side of our body. If you have anything that has a correlation to headache, and then anything going down to legs, those are things that are kind of scary. If you have facial drooping, one side of your face just starts to kind of do this, you need to go to the ER immediately and get those things handled. Those are just a little bit more of the scary things that come along with headache type pains that sometimes aren't just a headache.
Yeah, and sometimes too, if you haven't had any issues with vision or anything like that before, and all of a sudden you're now getting vision issues, whether it's seeing double or you pass out or you just can't see anything, that would also be another thing that would warrant going to see someone, a doctor, or going to the ER to get yourself checked out, because there are some serious things that can happen with headaches.
Yeah, those are big scary stuff. But hopefully you are not one of those, and we get to dive into some of the trigger management stuff. So trigger management is usually some of the best stuff for specific types of headaches. So if we're looking at that patient that comes in and they say, doc, I have a headache that happens every day at this time. I'm really stressed out. My kids get home at this time, and it gives me a headache every single day. What's going on? Those are tension type headaches most of the time, and it can have a little bit of everything with mechanical inputs, meaning your body starts getting kind of rigid and tight. Psychological aspects of you just keep on you're just thinking of all the things you need to do, and you're stressed to the max. So trigger management stuff for that is big. Writing down things that can bring you out of that environment, walking away from those environments. Don't walk away from your kids, that's not what I'm saying. But figuring out ways to handle those stresses is very, very big for decreasing the overall tone around your neck, around your head. So tension type headaches, identify the area, the time, the environment that you're in. How do you modify that? You modify it with different strategies of coping with that environment that you have to be in, or trying to change that environment. Sometimes the hardest thing for people is getting away from those toxic work environments or toxic people and those types of things. So that's for a tension type headache, making sure you identify trigger and environment and seeing how you can modify those things.
Yeah, and that can also extend beyond stressful situations. There's some people who can get headaches from simply eating a food that doesn't agree with their bodies. So you could also trial and error and see what types of foods may bring on symptoms, and then eliminate them for a period of time and see if it has an impact on what you're feeling. Other things to consider too would be, are you someone who's a clencher when you get stressed? Or do you grind your teeth at night when you're sleeping? That can also change the tension that's being experienced up in your head region and lead to some headache issues. You may consider, if you are someone who does clench during the day or grind your teeth at night, I would definitely mention that to your dentist. If you can find a neuromuscular dentist in particular, a lot of times what they can do is they can make devices to put on your teeth that can help reduce the stress load of your muscles in your head and your jaw throughout the day, and that can be enough to eliminate headaches. Also, another thing to consider, since a lot of us are now working from home, or we might be spending more time in front of the computer, eye strain for prolonged periods of time can also increase tension up in your head and your neck. When you are focusing on anything for an extended period of time, your eyeball constricts in order to see what you're looking at. Easy fix. Grab yourself a pair of cheaters. So you know how when we get to it happens at about age 45. That's like everyone who I've heard. 45 is when it happens, and you start to read something and you got to do this sort of thing. Well, why are cheaters useful for helping with that? Essentially what the cheater glasses do is they make everything bigger in front of you, so you don't have to spend as much effort focusing on whatever it is you're trying to read, and that can reduce eye strain. If that helps you, I would strongly encourage you to go get checked out by an optometrist, especially if you can work with a behavioral optometrist who does vision therapy as well, because they might be able to give you some glasses to help reduce your eye strain, whether it's on a computer or with reading. But then there's also, if you do vision therapy along with that, there's also exercises that you can do to your eyes and your visual tracking capabilities that may also reduce headaches. So it's more than just taking Advil. There's a lot of ways that you can improve this.
Yeah, good. It's kind of like goes back to what he was saying earlier about clenching the jaw. If you're clenching your eyes, that's going to hurt too. I mean, it's all really close to your head, so you can see that there's going to be a correlation there. And anytime that we have tissues in our body that constrict, our body will end up telling us, hey, this hurts. You know, it's just like if you've seen some of our other talks, we talk about muscles being under tension for a really long time. It's really hard to get blood flow. It's really hard to get oxygen to those areas. Same thing with the eyeballs. It's just a very, very small muscle. So getting oxygen and getting all the things that we need through there, very important. He touched on a point about figuring out things about to eat or what not to eat, I should say, for maybe like a more of a migraine type headache. That is very, very helpful to take a lot of things out of your diet that are known triggers. So you can ask someone that Zach or myself, and we can guide people on, hey, these are things that are commonly inflammatory for the body or potential triggers. If we eliminate all that stuff, or we identify things in people's diets that have a lot of those in them, and then we see, hey, there's a trend of headaches after this, even the next 24 or 40 hours they start having this. Then we start eliminating those things, and then we slowly introduce all of those things back in to see exactly which one is either the worst, or if you have multiple, we can identify a couple of them at the same time. So that's called like an elimination diet, and then slowly introducing some of those things back in. Very helpful for patients trying to really figure out nutritional triggers. That goes more towards a migraine. In my experience, that's been more towards a migraine type headache. And then another one for trigger management is understanding postural strains. And we always talk about there's not one posture that's always the best, but if you're constantly doing this for 6 hours and you're looking at a computer monitor over here, and you start to have pain on that side of your neck, and it causes headache on that side of your head, there's a possibility that being in that position is actually causing that. We don't want to marry ourselves to saying you have to have this golden posture, because most of the time that's not correct for most of our patients. But if you are in a certain posture for a long time, it can definitely cause some headaches. So that would be more of a cervicogenic type headache, or the neck causing referred pain up into the head, based on the position or the stresses that are going on to the neck. Any other trigger management? Looking at breathing patterns too. If you're a breath holder, typing away, and then if you have to focus and you're holding your breath, that could be another thing that you really need to identify as a problem, and that can, as you do more work and you're focusing more and you're in the zone more, that could be a big trigger for holding your breath, thus not getting enough oxygen to certain areas and certain tissues in your body, causing headache again. So again, trigger management, finding all those things we just talked about, rewind it back, find which one correlates best to you, and start figuring out those triggers, because whoever you go to see to manage this stuff is going to want to know those things for sure.
Absolutely. Now, let's get into treatment. So more often than not, the biggest treatment that most people will do for any type of headache is drug therapy. And that could be you taking a couple Advils, or that could be you getting prescribed something by your physician to help with headaches. And we want to stress that that is an incredibly useful treatment. And a lot of people might have some negative connotations associated with taking medication, but this is a pretty good research-based treatment. But what makes it even better is if you're already doing that, some of the de facto treatments that can be incorporated along with drug therapy that have been shown to be useful are exercise, relaxation techniques, and distress management. Now, if you only had 2 doctors that could teach you some things about that.
Exercise.
Oh gosh, how did we get here?
I don't know anything about exercise,
Yeah.
So you have to ask that.
Yeah, so that's what we're going to talk about. What we want to do for the remainder of this talk is we're going to give you some easy moves to incorporate with your headache treatment, and then we'll also give you some relaxation and stress management strategies that you can also incorporate to get yourself better. So
right off the bat, breathing's pretty easy for us to think about, but a lot of people do it very poorly. When we're taking someone through a medical evaluation, everything that they do when they come into an examination room, we're trying to keep a good eye on. And this is definitely one, if we see, the breath hold, the tension with the hard exhales, things that are really hard for them to do, and they're coming in with headaches, this is probably one of the main things we're going to target is how they're breathing and how we can get them to understand what a good breath is compared to a bad breath. You know, anytime that you're breathing, it's good, but you want to make sure it's efficient. So breathing is key. So this has been something that I've used for patients with actually a cluster headache before. It's getting a patient to breathe a lot at a little amount of time. So I usually have them be in a chair that if they start feeling maybe a little bit lightheaded or they feel like a rush of blood going into their head or into their body, that they have the ability to hold on to something so that they just feel steady. But it's going to be big inhales and big exhales. It's going to be expanding everything. Most of the time, when I've taught someone about stability of their breath, we think maybe down to the tummy. I just want as much air in, as much air out during this time as possible, because it might change the ratio of oxygen that you have in your blood going to other areas of your body. So if we can get a bunch more oxygen, then we might flush out those hard places that are needing oxygen. So anyways, big breaths in through the nose, exhale, long exhale, inhale and exhale, again keeping ourselves nice and steady, around 2 to 3 minutes, cycling through that. If you start to feel little tinglies into your hand, if you feel tinglies in other parts of your body, that happens, and just know that it will go away if you stop breathing really heavily. It's not going to stick around for a really long time, but that can divert a headache. If you're starting to feel that buildup of migraine, of your cluster, or whatever you think that you have going on, give it a shot. Over oxygenate and see what it does to balance out maybe some of those ratios. It's 2 to 3 minutes. Give it a shot, and if it helps, now you have a tool to, hey, every time this starts to come on, I'm gonna sit down. I'm gonna get through my breathing drills for a couple of minutes, so it helps divert those things. So give that a shot, and again, inhale, exhale, nothing special, but it's big inhales, big exhales. Try to over-oxygenate yourself.
Mm-hmm. Yeah, that's good. You can also utilize breathing if you're someone who has more of a neck-based headache to reduce some of the stress, tension, and load in your neck. So for this, I'm going to be nice to Kyle today, but I'm going to make him do a move. Go ahead and lie on your back. Knees will be bent. Actually, if you could put your feet on this chair, that would be amazing. They're clean.
What's that?
Your shoes are clean, right?
My shoes are clean.
All right. So, as you can see, I got Kyle hanging out on a chair, and I'm going to actually put, this could be a pillow or something, I'm going to put it right underneath the base of Kyle's skull. So go ahead and relax. And there's a neat stretch that we can do both from like a bottom up and top down perspective to improve range of motion of stuff in the neck. So what I'm going to have Kyle do first is I want you to give yourself a double chin, and then I want you to undouble chin yourself. So move your chin away from your neck. You want to think about this as like the CPR position. Don't worry, I'm not going to give you CPR, Kyle. So you're going to do that first. That's just a good resting position to put your neck into to eliminate some of the tension and some of the front muscles of the neck. So from there, what I'm going to have Kyle do to get the bottom portion of the stretch is to go ahead and curl your hips up, keeping your abs relaxed as you do it. You should feel some of the back of the legs working. Let's have your arms chilling by your side so you can get a little stretch in the chest. And I'll have Kyle simply do some nice, slow, long breaths. Go silently in through the nose. Longest exhale possible through your mouth. Keep going, keep going, keep going. You want to get as much air out as possible because that's going to create a nice stretch of stuff on the front of your neck. Yep. Keep your chin away. Up, 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 up. Good. Pause, pause. Keep a little bit of tension in your abs on the inhale. Good. Exhale, get it out. And this could be just a nice relaxing position you could do for 5 minutes at a time. If you want to kick it up a notch, Emeril Lagasse style, and you'd like to loosen up some things in your jaw, go ahead and chin away from your neck. Breathe in through your nose. Jut your jaw forward on the exhale and breathe out. So that's just to get a nice offloading position in the jaw to also reduce some of the stress and tension in some of the jaw musculature. And I'll just have people breathe in and out like that. And that's a great way to get your neck in a good position, to offload some of the tissues there, get yourself feeling better.
Yeah, and the head positioning is really key. And you can, if you drop the chin down, you actually can feel some stretch through there. So if you're feeling either way, if you have a little bit of tension through here, good spot to offload some of that stuff, because gravity's not really pushing down on you at this position. You don't have to stabilize your neck. So if you want a little bit of opening through here, it's kind of the opposite of what Zach just said. But if you're looking for more of a stretch through some of there, if you're doing this all day, looking at a computer screen just in front of you, then we might need to revert out of that a little bit too. So another position that can offload the neck. That's a good one. All right, so we looked at breathing. We looked at some offloading of the cervical spine. Another thing that we were speaking about was getting into trigger points around the jaw, underneath the jaw. These are all really kind of important parts of getting tissues to be relaxed around the head and the neck. So there's a couple of spots. I'll show one underneath the jaw that's been kind of important for a couple of patients over the years, and it has a lot to do with like the tongue going up and down or going out. So if you find a spot underneath your jaw, so we're up through here, the soft spots, not the bony part of the mandible or the jaw, we go right in through here, and we can extend, open, protrude the tongue a little bit, or we're going up towards the roof of our mouth and pressing and flattening the tongue on the top of the mouth. That gets some of the stuff to contract and relax, but you can also do pressure point work in there and see if that can relieve some of those little trigger points, those little nasties underneath there. And you can go all the way through the back portion to the angle of the jaw, finding any of those little spots. If you, when you're young, if you had your mom check for your tonsils, the little bump that goes underneath here, if you're sick, don't press too hard on that one, because that's not a good one to press on. But anything that goes along the ridge of the bone there could be fair game for a little bit of trigger point work or pressure point work.
Fun factoid, I often get cramps here if I'm stressed. It's really bizarre.
There it is. And a lot of tongue work, a lot of trigger point working through there.
Yeah.
Could be a savior for some of you guys.
Yes, indeed. Another great thing to work on would also be like on the front of your cheek. This is the fancy words, your pterygoid muscle. But if you go like not so far back to where you're hitting bone, but just a little bit in front, and you press in that region, well, one, it's usually going to be pretty sore on most people like myself. But if you just massage up and down in that area, that can be also a great position to reduce headaches. I've had quite a few people where I've just done a little bit of hands-on work in that region, and it takes the headache away in a jiff.
Yeah.
Another great spot, which you can see quite well on me because I'm bald, would be not the base of your neck, but the base of your skull on either side. So I'll demo that. Can they see me on?
Perfect.
So it's like right here is what I'm talking about. For those on this video, boom, right there. But if you press in that region, one, it's usually pretty sore, but if you're someone who gets headaches that kind of wrap over the front of your head, one of the attachments of that specific muscle is the base of your skull. So if you press back there for an extended period of time, that could be another quick way to relieve some headaches.
Yeah, don't press too hard, because I've had some people that'll do that and they'll actually irritate more. So it's a happy medium. You can't just jam in there pretty hard and cause more. Sometimes it'll have a little bit of referred, but if it stays pretty low, 2 to 3 to 4 maybe out of 10, that's what you want. You don't want to jam up to the 6 and 7s and cause yourself more irritation, because Zach and I have had those patients too. That they just go over the top. They try to hit the 10, and they're like, yeah, if I make it a 10, it makes the pain go away or the pain change. Well, yeah, of course, it makes it sometimes worse later on. So don't jam on there too much, but give yourself some small tensions and build up from there as you increase those pressures. And the same thing along here, along the jaw. Start light and then increase if you aren't getting some results that you want. Let's see, what else we got on here. So looking at cardio, this is a good way to, again, we're looking at this oxygen ratio when we were talking about over-oxygenating. If you're not one that wants to do this kind of sitting here breathing, you can also go for a brisk walk and then really try to increase your amount of air that you're intaking during that walk, because the ratio can change, and that can change the amount that the tissue is painful and kind of causing some of those signals to come up to the brain for pain. So oxygenating with low, like steady state cardio, just walking, things that keep you moving, and it doesn't have to be to the point where you're just like panting, but just a nice brisk walk. Those definitely help.
Yeah, the power of walking is vastly underrated.
It is.
So it doesn't have to be high intensity stuff. Sometimes that can increase pressure in the head and be an issue. So if you are symptomatic, simply going for a longer walk or even doing some light biking or anything like that can be extremely useful.
Yeah, the threshold thing that you just said is big. You know, the people that push to try to get to a 10 out of pain, if we tell them cardio, they'll go, try to PR their mile. Those are the people that can have throbbing headaches afterwards.
You got to slow cook the brisket first. If you burn the brisket, then you got to get a new piece of meat. So we want to make sure that you turn out okay and you don't have any issues or flare-ups.
Yeah, so those are the big things that you can do mechanically that will help offload some of those tissues or get more oxygen into them. Next, we'll talk a little bit about distress management, because there's good stress and there's bad stress, and we need to figure out how to manage some of those. Like Zach was saying earlier, research is saying that stress management is one of the bigger ways to fight headaches, because headaches can be such one, debilitating, but also it's really hard to find help sometimes with those. So meditation and journaling, those are big ones for getting your stress to be managed. One thing I like to tell patients is how to offload your plate at the end of the day, meaning how much you're thinking about. So if you can write some stuff down, if you can take your thoughts, put them on paper, take your thoughts and talk to someone about them, so that you know that somewhere something has heard your stresses. That's a good way to offload those. So whether it's a person that you love and you really trust, talking to them about your stresses, taking your stress level down, or writing them down so that you know that you can handle them later. You're just not going to handle them while you're going to sleep and while you want to be in a relaxed state. So those are the two that I like to have patients do for offloading their plate.
Yeah, I would agree with you on that. And if you don't have someone who you can offload, or you're already journaling and you need a little bit more help, do not underestimate the power of psychotherapy. It's a great way to have a objective and non-biased person to bounce ideas off of and work through it from a professional standpoint. There's an app that I recommend for a lot of my patients and clients called Talkspace that you can just load up on your phone. You have access to several therapists in your state that you can work with, and it's extremely useful, and it's fairly affordable depending on how much you need. Other thing to consider too, we touched on meditation. If you are new to meditation and you're a little sketched out by the ohms and ahs and you don't know where to start, there's some really good apps on your phone that you can use, both free and paid, that I recommend to patients, and stuff that I use for myself when I'm consistent with meditation. Insight Timer is a free app that you can use that has several guided meditations. My favorite, and the one that I use, is the Waking Up one by Sam Harris. It's not as woo-woo-y as sometimes we can get with meditation, which is why I like it.
Yeah.
So if that's not your bag, I strongly recommend the Waking Up app. I also think Headspace and Calm are also very good apps as well.
They're more popular.
They are. I like Headspace because Andy's got that British accent, in through the nose, out through, and there's something about that's just incredibly relaxing. But all of those are really useful apps, and a lot of them have free trials. So you might just want to test out each one, find which works best for you, and it doesn't have to be long. It's just like practicing anything. You might not see the benefits right away, but if you consistently practice meditation for a few months, you might look back and say, oh wow, this trigger and that trigger used to send my headache through the roof, and now I just get a mild headache.
And he hit it right on the head, looking at consistency there. We have patients all the time. if you get a certain recommendation and it's not followed through, it's not that you didn't get a good recommendation. It's more about hammering that stuff into your routine. You got to make a change to see a change. So make sure that you're taking recommendations seriously and seeing them through. If it doesn't work for you at the end of a trial of care, that's fine, but you can't shortchange yourself and think that it's not going to work. You got to give it a decent amount of time to see things happen. It's just like investing. You let that stuff build over time. You invest financially to see stuff long term. Same thing with your health. You want to make sure that you're doing breathing patterns. You're trying to meditate. You're trying to journal. You're trying to do those things to actually see if they help you. That's one of the biggest things that people fall off of care, or they feel like they're untreatable, is the consistency in trying to get some of that stuff done. So if that's you, if you feel like you've tried some of this stuff, or if you haven't tried some of this stuff, identify one thing to try and give it a shot. If you guys need guidance on that stuff, Zach, myself, we're here for you guys because we want to make sure that you have answers and you have a plan and you're going to follow through with those plans. That's the biggest one. Consistency.
Consistency is key. Most of the things that are worth it in life take a lot of time and effort to build up.
Yeah.
Freedom from pain, especially headaches, is one of those things. But there is hope. You can get better if you stick to it, and Dr. Booth and I would be happy to help you along the way.
Yep, headaches are a bugger, but if you have any questions in the comments, as always, or reach out to us. We have our Instagram that you can reach out to us, or if you want to email us or call us, all that stuff will be at the end of the notes here, and you'll be able to contact us with whatever you're most comfortable with.
Happy journey on your way to headache freedom, and we'll see you next time.
What do we have next week?
Next week is, gosh, and you're going to ask that.
Hang on a second. Stay tuned for 1 second. We have scheduled next week. We're talking about bone mass and how to optimize your bone mass. If you feel like you are one that is maybe losing bone mass, or you have someone in your family history that has a bone mass issue, this is going to be for you.
Yeah. Osteoporosis, osteopenia.
Yep, all those.
We'll be seeing you.
All right, see you guys next week.
Take care.